Hello, everyone. Thank you for joining. Before we begin, I would like to pass it to our interpreters, Aldo and Anais, who will explain how to access Spanish interpretation.
Buenas tardes. Los organizadores del evento de hoy tienen la firme determinación de crear un espacio multilingüe y con esa finalidad contamos con interpretación disponible en español e inglés. Les pedimos a todos los participantes que hablen lentamente y en voz alta y clara en sus micrófonos para facilitar la interpretación. Al terminar este anuncio, activaremos la función de interpretación y si usted está usando la aplicación Zoom, podrá ver el icono de un mundo en la parte inferior de su pantalla. Haga un clic en el icono del mundo para escuchar la interpretación y seleccione español. Si usted está usando la aplicación Zoom desde su teléfono, haga clic en los tres puntitos donde dice More o Más. Seleccione Language Interpretation o Interpretación de Idiomas y después Español. Si tiene algún problema al hacer esto, por favor escribe un comentario en el chat. Gracias.
Thank you. Hello, comrades and friends. Welcome to our International Day of Action, Vaccines for All convening. My name is Mia Tada, and I'm here with the People's Forum, a political and popular education space based in New York City. We're holding this event as part of an International Week of Anti-Imperialist Struggle, which has organized events across the globe from today, April 7th to April 11th. We're very excited to have you all, and even more excited to have Terrell Turner from the organization Put People First moderating this event. For those on Zoom, you can submit any questions you have using the Q&A function below. And for those on YouTube and social media, you can use the chat to submit questions. With that, I'll pass it over to Terrell to introduce himself and the speakers.
All right, can you hear me? All right, how's it going? My name is Terrell Turner. I'm with Put People First PA, and I'll be moderating this event. It's a really important one we have. Too often, when we talk about issues involving public health, it's often framed with a corporate bias, and that bias keeps a lot of valuable information away from the people, information that we need to take care of ourselves and one another, and we don't have the luxury of profit and capital to back us up. So we have to ask these questions in a complete and honest way, in a way that will actually advance us forward and keep everyone safe. I'm going to be introducing the speakers, and each speaker will have time to introduce themselves. First, we'll have Nijmi Zarenko. Then we will have Rev Carolyn Foster from the Nonviolent Medicaid Army. And I'm sorry, Nijmi Zarenko is from Put People First PA. Then we will have Rosemary Rojas, Border Agricultural Workers Project. Then we'll have Walter So from the Physicians for a National Health Program. We'll start with Nijmi. You introduce herself and the organization.
Great, thank you, Terrell. Appreciate it. It's really wonderful to be here with all of you today on this International Day of Action for Vaccines for All, and building, a global working class project of transforming and fighting for healthcare that is everybody in and nobody out. That also applies to the vaccine. I want to share a couple of stories and snapshots from the ground in Pennsylvania, where we're organizing with Put People First Pennsylvania across the state, organizing and fighting for healthcare as a human right among the 140 million nationally poor and dispossessed people in the United States, and in Pennsylvania, the over 5 million poor and dispossessed people. So the situation with vaccines has been called the vaccine Hunger Games. That's a kind of a joke, but really it speaks to the kernel of truth, which is that like the rest of the healthcare system, the way that the vaccines have been distributed has been in an inequitable way, in a way in which it's every person, every family for themselves trying to figure out how to find it and how to get it, and also what the process looks like. So that's a real, it's been a real stark example of what existed before COVID, which was a healthcare system that puts profit over people. And the vaccine is an experience. The situation of COVID is an experience that we're all going through around the entire world that shows the irrationality, the anti-human nature of a healthcare system that's based on profit over people, and the fact that it is a direct cause of death for, in this country, over 500,000 people and counting who have died as a result of this virus. I want to share a couple of examples of the way that this has played out, and even the role of the state in contributing to the inequity and the confusion around the vaccine. I live in Philadelphia. We're a statewide organization. Terrell is in York County. We're actually in 17 counties around the state. But just right here where I live, there were several examples. One being that the nonprofit entity that has the contract from Pennsylvania, from the state government, to do public health care emergency management itself did not respect the rules of the order in which folks were to get the vaccine. And that entity, the Public Health Management Corporation, the CEO, invited their friends and family to be vaccinated before even the healthcare workers in their own healthcare centers, in their own healthcare clinics. This is just one example of many that we've seen of the way that the vaccine is not distributed in an equitable and universal way, particularly to poor and dispossessed and working class communities, communities of color, indigenous communities, not only here in Pennsylvania, but around the country. So I think from when we look at that and we see that there is a level of hoarding of the vaccine on an international scale, yet and still the thing that people don't realize, certainly looking from the outside looking in, is that we're still not getting those vaccines. The poor and dispossessed 140 million are not the first in line. We're the last in line to receive the vaccine. Efforts are certainly being made to change that from the bottom up. And we're fighting for vaccine access. Our folks out in Western Pennsylvania, in the Mon Valley, right now, I was on a call with them today, and Pittsburgh are trying to hold their county government accountable for getting the vaccine to the hardest hit areas, getting the vaccine to people in ways that you don't have to have a car to access it, right? You don't have to be right downtown to access it. This is a serious issue that's taking place across the state. And in a state with 67 counties, we have only a few county health departments. We have 6 county health departments and we have 4 municipal departments in a state with 67 counties. So many counties have no county health department. And this is the reason that we're fighting for a public health care advocate at the state level to actually fight for the healthcare rights of everyday people and to work with, county health departments to ensure that things like the totally inaccessible, inadequate rollout of the vaccine, don't continue to happen, that can amplify our voices and our struggles in this process. And then I think the last point that I want to make is that just as we have to be monitoring the situation on the ground among our people, among the working class, and fighting for access to the vaccine wherever we are, we also have to be understanding that global dimension and understanding that the fight is also against the quote unquote intellectual property rights of the ruling class to something like this vaccine. The fact that Bill Gates, one of the richest people in the world, and someone who, is a funder of much, even social justice work that happens in this country, is the reason why AstraZeneca, who was planning on making their vaccine a public good, didn't do that. And ultimately, it made it into a private, commodity. He is the person who ensured that didn't happen because his whole wealth is based on intellectual property rights. And so these are also the struggles of our class. It's to acknowledge, and to fight against the idea that, you know, this is the people's vaccine. The research and the development, the funding for that was given to people came from our taxes, it came from our money. Yet and still, at the end of the day, the vaccine becomes a commodity. The intellectual property rights are not owned by our class. And therefore, we have the kind of situation globally that we have with regard to how the vaccine is being distributed. And so we need to understand that dimension and be fighting against the idea that that any kind of medical invention, vaccine, technology is the property of members of the ruling class and not the property of the working class, and to be given and distributed to the working class as it is needed. And so that's another dimension of this that we have to keep in mind, both the situation on the ground directly where we are and the global situation as well. And this is something that really causes us to be in solidarity with the working class around the world.
Thank you, Nijmi. Now we'll be hearing remarks from Rev Carolyn Foster from the Nonviolent Medicaid Army.
Thank you so much for having me here tonight. I am really excited to be a part of this wonderful discussion and among these wonderful speakers. I am Reverend Carolyn Foster. I serve as a deacon in the Episcopal Diocese of Alabama. I work for a nonprofit social justice and direct services organization in Birmingham called Greater Birmingham Ministries, and I serve as one of the chairs for the Alabama Poor People's Campaign, a national call for more revival, and we are a part of the Nonviolent Medicaid Army. My work with Greater Birmingham Ministries has expanded over many years. I served on the board before I joined the staff several years ago. And part of our work at Greater Birmingham Ministries is to provide emergency services for people who are in need, such as needing food assistance or help with their utility payments, or help with rental assistance. But our relationship with those people afford us the opportunity to get to know them, and they get to know us, and they're willing to share their stories with us. And we get to hear that they may come to us with a particular issue or presenting in a certain way, but many times their issue can lead back to other systemic problems like lack of health care. And like the fact that in our neighborhood, GBM is located in a community where people can get to us if they have public transportation and no transportation of their own. So we know what systemic issues can cause getting back and forth to the doctor. And so with this vaccine, we began to see when Alabama started receiving the vaccine and these sites were beginning to pop up around us, it was just that, around us, and not in communities who were directly and most harshly impacted by COVID. People who were working essential jobs, people who were having to clean the floors or pick up trash in their neighborhoods, or even the bus drivers. These sites were being set up in communities where you had to have a car to get to it, or if you didn't have a car, you had to try to bum a ride from your neighbor or your friend, and definitely you couldn't get the bus to go there. And so immediately we saw the inequality in where these vaccine sites were being set up. Yet these sites were serving people who were not as directly impacted as the people we were serving. So we thought we've got to take this into our own hands. And so actually 2 weeks ago, we've started making inquiries about the location where we are located, right in the heart of downtown or just outside of downtown, but on the bus line, and people come to us for food, clothing, and they can get to us. Let us be a site. It took a lot of work, but we were able to do it 2 weeks ago when on 2 days' notice, we got word that they had some vaccine available, and if we were able to set up in 2 days, could we do it? And we pulled it off. And I'll share one story. We borrowed, there's a nursing home right next to us with a pretty large parking lot, and we used their parking lot as the waiting site once people got their vaccine, where they could sit and wait their 15 minutes out. And I had organized volunteers to be there and to check on the people who were waiting after their vaccine. And we had snacks. We made it a very lively kind of experience. And one of our volunteers walked up to a car, and the woman was weeping. And they asked her, "Are you okay?" And she said, "Yes, I am just so happy. Happy to get the vaccine." She probably didn't have a computer to try to register, which is a systemic issue. If you don't have Wi-Fi, if you don't have internet, if you don't have a computer, how are you going to even register to get on the list? There was just so many systemic issues that were keeping people that we serve every day from getting the vaccine. And so we at Greater Birmingham Ministries and our work with the Poor People's Campaign have been working about making healthcare more equitable. Alabama, this state has not expanded Medicaid. So people in this state have been suffering with lack of healthcare, proper healthcare forever, since we refused to expand Medicaid. 45% of Alabamians are poor or low income. That's almost half of our population. Yet they refuse to expand Medicaid. And they refuse to make healthcare like vaccines accessible to the people who need it the most. And I come at this also as a person of faith and as a faith leader, because I believe everyone should be treated with dignity and respect regardless. And no one should be overlooked. I think Nizmi said it, everybody in and nobody out. I come at this from that perspective. And when these sites are being popped up in wealthy neighborhoods and not in underserved neighborhoods where they are definitely needed, that's a problem in my sight. And it's an affront to my faith. And so we continue to work in this area and to lift up these issues. And like Nizmi said earlier, this happened where we were able to be a site from the bottom up. We had to push. And why not bring this service to the people? Bring it to the people so it is more accessible. It can be done, but poor and low income people have been overlooked or completely ignored for far too long. And that's something that we are fighting against with the Nonviolent Medicaid Army and the Poor People's Campaign and Greater Birmingham Ministries and my faith tradition. So thank you for letting me be a part of this.
Thank you, Reverend. We appreciate your work and your remarks. Next, we'll be moving on to Rosemary Rojas from the Border Agricultural Workers Project.
Buenos días, tardes y noches a todos y a todas. First of all, on behalf of the Border Agricultural Workers Project from the United States-Mexico border, I'd like to reaffirm our total support to the International Manifesto for Life. Life is above profit, vaccines and public health free for everyone all over the world. Now, it cannot wait. Our total support to the actions taking place all over the planet, beginning today, International Health Day to call for the protection of the life of people, especially the lives of the most disproportionately affected by the pandemic, the women, the migrant farm, rural workers, domestic and food service workers, the unemployed, the children, the elderly. we have so many in our community that have been excluded. Savage capitalism brings us crisis after crisis. It is its nature, but the terrible crisis of COVID-19 has no precedence in this modern history. Everywhere we see social, environmental, and economic devastation. Everywhere we see a lot of suffering, sickness, destitution, hunger, evictions, dispossession, and exclusion from these programs and institutions that supposedly should provide us with the most basic means to get out of this pandemic alive. But now we can no longer even honor and give our dignified burials to our dead, to our family members, to our compañeras and compañeros. I am an Apache Yaqui woman, and during my childhood and adolescence, I worked in the agricultural fields of Bakersfield. And it was in those fields and the intensive heat facing the abuses and mistreatment of myself and of the working people around me that I became conscious of the reality of exploitation and oppression in the agricultural fields. In the Valley of California, I experienced firsthand the brutal exploitation and became aware of the misery caused by capital to generate more and more profits by squeezing our workforce to the fullest. Naturally, I became aware how the state and most of the institution operate to safeguard the interests of the agribusiness, to contain the organizing efforts, resistance, and struggle of the oppressed farm workers. But what struck me the most in my conscience and is in my heart, the even more oppressive and brutal conditions suffered by women who work in agriculture. To this day, women who are single mothers, heads of households, continue to work under the terrible working conditions. I've spent, not only do they suffer from the bad wages and the terrible working condition, which exposes them to the highly toxic chemicals, but they also suffer from abuse, violence, verbal attacks, constant sexual harassment, and rape. They work harder than the men, just as long as the men, and they receive less than half of what the men make in the fields. The constant sexual harassment and rape is an issue to this day. I worked in the fields as a child, and I was one of those children that suffered raped in the fields. And I have never publicly stated that. I usually state that when I talk to small groups. But yes, I am a survivor of the brutal conditions of the fields. I've spent many years organizing and raising awareness among the farm workers of our El Paso and New Mexico region, and to demand the respect for the rights to improve their wages and working conditions, and above all, to ensure the agriculture industry in the region treats them with dignity and justice. The pandemic crisis dramatically worsened the condition of the women in the fields. Once the schools were closed, the women had to stop working to care for their children at home, to feed them, to try to help them with their online classes. But at the same time, they were excluded from the economic relief programs by the federal government, as well as the emergency and prevention strategies implemented to face the contagion and the spread of the coronavirus. Many compañeras fell ill and do not have the means to cure themselves. And that is why so many died due to the pandemic, leaving their children and entire families who depended on the little income they managed to get working in the fields stranded. During these years of intense organizing effort, we have made some progress and changed a little of the reality of the exploitation suffered by the men and women who are the foundation of the rich agricultural industry in the border region, such as the multi-million-dollar chili industry, the onion, the pecan production, the dairy farms, and other industries that rest on the back of thousands of farm workers who travel in the wee hours of the morning from El Paso, Texas, Columbus, New Mexico, port of entries, and elsewhere to toil in search of livelihood to support their impoverished families. When we began organizing in the early 1980s, the workers had no laws or regulations to protect them, no benefits like the rest of the working class. The use of the cortito, which is a short handheld hoe, was not prohibited when the workers applied for from the workers. And so when the workers applied for unemployment benefits, food assistance, or got injured or sick in the fields and asked for compensation, they were turned down. Little by little, by organizing them to build the collective power needed to push their interests, we begin to generate changes and achieve some degree of justice through their own actions, but also thanks to the support of organized workers, of many allies, and our border community. The Border Farm Workers Center is our most important achievement. So many years of struggle. Located in El Paso, where the farm labor that feeds the agricultural industry in southern New Mexico and elsewhere is recruited every night. The Border Farm Workers Center represents a vital space of support. From there, farm workers leave very early in the morning for the grueling work days and return from the fields at the end of the day and regained a little of the humanity that is lost in the fields. However, there is still much work to be done. Full justice has not yet come into their lives. I want to close my presentation by saying a few more words about the current crisis that is afflicting all of us. COVID-19 has particularly affected those most marginalized, forgotten by public and private institutions, farm workers and their families. In the case of New Mexico, the agriculture industry doesn't care about the lives of the farm workers, but only getting the job done. Indeed, the onset of the pandemic, farm workers were designated as essential workers who should continue to grow the food so necessary for the population to survive the crisis, but they failed to issue the most elementary prevention and protection measures in the agricultural fields. It has been a terrible year of death and suffering for the farm workers and their families in southern New Mexico. The contagion in the field, the workers are being transported in vans loaded with more passengers than should be transported. The fact that in fields, social distancing is non-existent point to a terrible outlook when the intense season is starting in a few days with the onion taping. But there's something that can be done to lessen the crisis faced by farm workers and their families. We must force the agricultural industry to treat them as human beings, to respect the rules and regulations that can help to contain the contagion, because this pandemic crisis has come to further expose the inequality, the inequity of the savage capitalistic system against the women and people of color. We must redouble our efforts in our fight against the patriarchy and racism. It is time to end the white privilege that so much misery and suffering has brought into our lives for more than 500 years. And we must demand concrete, immediate actions, such as vaccinations of all farm workers to at least try to create some immunity in agricultural production. Today, we demand public health rights for all, especially for those who today have been marginalized, are living the worst nightmare of their lives, despite the fact that they are essential of agricultural production in this Puerto region and everywhere else. Today, we join our voices to the call of life above profit. Today, we have a basic demand to protect life. All agricultural workers and their families must be vaccinated to protect them from coronavirus. I thank you all for this time and space, and just a little bit of good news. We managed to force the local city government, the emergency response team, to come to the Farm Workers Center, and we were able to get a small fraction of our farm workers vaccinated. And it hasn't been without a battle, and it continues to be a battle because we still have hundreds more that we need to vaccinate, and we're fighting for those vaccines. Muchas gracias. My gratitude. Thank you so much.
Thank you for those remarks, Rosemary, and for your work and continued effort. Next, we'll be moving on to Walter So. He represents the physicians for a national health program.
Well, thank you so much, Terrell. I don't know if you can put up my slides, but while you're doing that, I just want to acknowledge my prior speakers who gave very courageous discussions, and particularly to you, Rosemary. That was a powerful talk about your life with the agricultural farm worker business. Anyway, I'm going to talk today about access to vaccinations. And next slide. I'll begin actually with something around Physicians for a National Health Program. So we are health professionals who support a single payer, or if you want to call it Medicare for all, or otherwise known as National Health Insurance System. And we want us to move away from a discriminatory employment-based health insurance system where, in the ultimate irony of our COVID pandemic, people who lose their job because of the pandemic have also lost the health insurance just at the very time that they need it. I mean, how stupid can we design a healthcare system? We also believe strongly that everyone should be covered, that healthcare is a human right, regardless of their immigration status. We know that healthcare costs are currently out of control. No one can afford to be sick in this country. And the way we finance healthcare, because it is based on a discriminatory employment-based health insurance system that disproportionately marginalizes Black and Brown communities, it is in its own way the very symbol of institutional racism in this country. And the fact that we are unwilling to tackle this issue of Medicare for all from Joe Biden on down, and they're unwilling to take on this issue, is a perfect example of how difficult it is to tackle institutional racism in our country. Next slide. I come from Philadelphia, and I just want to show you some slides from our city. I draw your attention to the slide on the right that says race by week. This is the most recent data from yesterday, and it shows that despite our efforts in the city, the Black and Latinx communities are significantly lower in the rate of vaccination than that of the white and Asian communities, according to city statistics. On the left, you see a map of the city of Philadelphia. And in red circle there, I point out the area where we have the lowest rate of vaccinations. If you know anything about Philadelphia, you know that this is actually North Philadelphia, which is the poorest part of the city. And it's one where traditional access to healthcare has always been problematic. Next slide. The city knows this is a big problem, and they have actually specifically tried to put more healthcare providers in the zip codes where the low rates are occurring. And despite the fact that the city is trying to do that, maybe through community clinics or targeting pharmacies that are in these zip codes, the number of people who are getting the vaccines or agreeing to get the vaccines still is remarkably low. And it does raise a question as to why is that in America with all the resources we have and the fact that, you know, the vaccine is free, that we have so many residents who are unwilling to get the vaccine. Next slide. Well, I think this goes back to a larger question about why is it that people, what's behind some of this vaccine hesitancy? There are lots of questions that we can talk about, but I believe that one that has to be discussed is what happens when you take an entire generation of Americans and you teach them that we only have a market-based approach to healthcare, that if you don't have any money, you don't get healthcare in this country. And that the expectation, if you live in North Philadelphia, is that you're going to be uninsured. Or if you're a migrant farm worker, you're going to be uninsured. Or if you're any number of the marginalized people in our society, you're going to be uninsured. We have taught an entire generation about that essentially you don't go to see a doctor until you are really, really sick. And now suddenly this society says to you, oh, guess what? We have a vaccine. We're going to even offer it to you for free. and we want you to take it. And now all of a sudden, having learned really never to get health care in our society because we have an overtly discriminatory and racist healthcare financing system. Are you surprised? Are we surprised that people are suspicious that they do really don't want to get this vaccine, or they don't want to know, they want to know what's going on here? Why all of a sudden are you saying, foisting, if you will, this vaccine on me when you have basically denied healthcare services to me for my entire life? And you have to ask yourself if you could create a worse healthcare system that guarantees a pandemic will spread. You could not invent something worse than the American healthcare system. We have taught an entire generation to distrust healthcare, that the only way you get healthcare is you have to come up with some money, that you have a system that perpetuates systemic racism, and that if you lose your job, you're also going to lose your health insurance with that. And of course, what that all means is that we have 500,000 people, more than 500,000 people who have died of this of COVID. We have thousands of people every day who come down with COVID, and we have a whole system where we have overtly, we have a whole system where we have people who basically want to deny people health care services because we don't think they're deserving or whatever. And that's part of the reason why we have the worst track record, even though we are supposedly the richest country in the world, the worst track record in terms of handling this pandemic. It's a total worldwide embarrassment. Next slide. And in addition to the fact that we have a discriminatory healthcare system, we have no national health database. I mean, think about how people have to get the vaccine now. I mean, if you have the resources, you can go on the internet, and now you have to sort of sign up with every pharmacy, every clinic. We have whole groups of people out there whose job it is to try to game the system. And there are a lot of people who have many, advantages, who have managed to sneak in above those who are more deserving. And so that is really a ridiculous system. And we have people who are overscheduled for the vaccinations at the same time that we have people who are not scheduled at all, who are most deserving of the vaccine. And so we actually cannot figure out how to do this right because we don't have a national database. If we had a national health database, we could have actually told people, this is your appointment date, this is when you're going to be scheduled, and we could have done this in a much more orderly fashion where people don't have to search on all kinds of internet sites to try to find the vaccine. And so again, because we fail to have a national health database and a national health insurance system where we could do this in a more logical and orderly fashion, we've created an overtly discriminatory, irrational, chaotic way of vaccinating people that is actually only perpetuates the inherent discrimination that our current healthcare system has. So I could go on, but my point here is that those of us who have been fighting this battle for healthcare reform are a bit surprised that we can get millions of people to march on Washington on climate change, millions of people for the Women's March, millions of people who can storm the Capitol on trying to overturn an election. But we can barely get 1,000 people to show up for a healthcare rally because of our discriminatory healthcare system. And this is a call to action to all of you who care about healthcare. If you really want to care about healthcare, do something about our overtly discriminatory healthcare system. We need to fix it. We need more people to get access to it. And when we fix our healthcare system, we can do a much better job for our country, and we can and one that is deservedly of a country with the richness and wealth and goodness that actually exists in the American people, but not in our powers that be and our politicians and those who control our healthcare system. So I'll stop there, and I'm happy to answer any questions.
Thanks, Walter. I really appreciate that, and the data you provided. Now we're going to move on to questions that we prepared for the panelists. Each panelist will have one to give the panelists, each give the panelists time to answer these questions, and we can start right now. As we all know, there was a vaccine rollout, but it was done in a disorganized and inequitable way. Do you believe this was avoidable or inevitable, and why? What are some obstacles that folks in your communities have been facing in getting the vaccine? And I believe when it comes to these questions, we can answer them in the same way the panelists were introduced. So we'll first go to Nijmi.
Sure, thanks, Terrell. Yeah, I mean, right at the beginning of the pandemic, last year and around this time, the month of March, Put People First came out with a series of COVID-specific demands that build on our overall platform and our demands on healthcare as a human right. And we recently did a section of our steering committee meeting where we actually looked around the world at what other working class people internationally are doing and also calling for around the vaccine. And we noticed how similar our COVID demands were to the demands in South Africa of the Socialist Revolutionary Workers' Party, which include things like, directing production of personal protective equipment for everyone and directing production and distribution of the vaccine, and really taking hold of the measures that are at hand to really support and help everyone. In Pennsylvania, I know we've been looking a lot at rural hospital closures across the South. In Pennsylvania, between 2019 and 2020, 8 hospitals closed in our state. And so we called for actually taking over those hospitals, reopening them and using them. If you remember at the beginning of the pandemic, we were getting tested. They were setting up field hospitals out in the street, under tents. It was a situation where when it was raining and windy, they would have to close them down. And we said, this is unacceptable. So can it be done better? Absolutely, it can be done better. It needs to be directed. There needs to be clear, again, an entire focus of the state in actually taking care of people and using the measures at hand, opening hospitals, directing production of personal protective equipment and vaccines, distribution of vaccines. Those things are all possible. They're very much measures that we saw taken in China, taken in Cuba, taken in Vietnam, other places around the world. Very possible to do. We don't have a system that's set up that way, though. That's not how our system works. We have, anarchy of production and a Hunger Games as a result, but very possible to do if we are able to transform our society.
I believe what Walter Tsao said is exactly on point in terms of institutional racism. I think that people who do not have proximity to the poor, to the marginalized, to people who are suffering, that group of people never even crossed their mind, and that's my personal opinion. So when these kinds of situations happen, the people who are in power take care of their own. They gather in their tribes and they take care of their own, and they have no relationship, no proximity to people who are marginalized and vulnerable and poor and low income and those kinds of things. That's why I think it is so important for people like that are participating on this call and the various groups that we are a part of continue to lift up the voices and the faces of people who are suffering and make them seen and heard, because for far too long, people who can choose who to ignore. And that is not acceptable to me. That is not acceptable at all. I think you were right on target when you talked about institutional racism, because I've seen it, I've experienced it. This is something that I also teach, because I'm also an anti-racism trainer for my denomination. And we've got to get people out of their silos. We've got to get people to see that healthcare is a human right. It's a human right. And it should be more accessible and more equitable in people getting treatment, particularly for this vaccine. When it makes sense to me that when people were mostly getting infected by COVID-19 and they were looking at that particular population of people, poor, people of color, then why not, when the vaccine became available, that's the group that you first target to vaccinate. But no, it's about systemic and institutional racism. It is about taking care of your own first. And that is a big power shift that we need to really change in this country. We've got to have more proximity to people who are, and more relationships with people who are directly impacted. And we need to figure out a way to make that happen with people in power.
I was going to let you ask the next question because I've offered my piece on that issue.
So Rosemary, did you just to let you know, if you need me to repeat the question, I can. But other than that, it's on you.
First of all, I don't really remember it exactly, but it's the question about the inequalities. If you could please repeat it.
Absolutely. As we all know, there was a vaccine rollout, but it was done in a disorganized and inequitable way. Do you believe this was avoidable or inevitable, and why? What are some obstacles that folks in your communities have been facing in getting the vaccine?
First of all, we do believe it through the experience that we have gone through over the past year, that it was something that could have been avoided. It was deliberately not avoided. When the vaccine, when the pandemic started, we knew that we were not going to get any help from our local, state, or federal government. And we knew this because of the intensive militarization of our border. Our center faces the wall of hate, and we sit in between the two international bridges where our farm workers travel in the early morning of the hours to the agricultural fields. We knew that we are in such a racist state that it is no longer covert, it is overt, in your face. And we knew that we had to we had allies, we had to bring them together. And when we were all together, we realized that the only way we were going to get anything done is for us to do it ourselves. We had to close the Farm Worker Center for public use because we used to have training education classes and host different people from different universities there. We had to close our citizenship classes. We had to close our Zumba classes and other activities, social service class, work that we have there. We had to close everything. It was only open for the farm workers. We went into a fast mode training program. I was a pediatric nurse for many, many years, so I used that experience in infection control to start talking and educating the farm workers on what we had to do to protect ourselves. We had no access to PPEs. We had no access to cleaning supplies. Everything was hoarded in our border community. The our allies in our community came together to make sure that we had PPEs. They made them, some of our women made the masks the best that they could. We had the donated supplies from so many places for the cleaning antibacterial gel that we handed our farm workers to be able to protect themselves, but they had the education to back it up, since we had so many training classes there, that they formed their own health care committee, where everybody that came into the farm worker center had their temperature taken, had a small health sheet questions to be answered if they had been traveling, where they had been traveling to. We asked for emergency contact numbers because we knew that they would be lost in the medical system if they were taken to the hospital, because you just can't leave bodies on the sidewalk. And it was for the city a big PR, more making it look like everything was okay when we knew it wasn't. So we knew that we had to be in the face. We knew we had to be with our boots on the ground, and we knew that we had to hit every single media outlet that we could, because we knew that we had some people within the media that would. And in Mexico, I have to say, we had more support to out these savage practices that continue to afflict our community. We had to do that. It wasn't done for us. So I fast forward now to the COVID vaccine rollout, and definitely we were excluded from that. Our farm workers were excluded from that. Our barrios, our marginalized community, and that is a big percentage in El Paso, Texas. We are one of the most poorest in the nation here, our community that sits here on the border region. So what we had to do was we had to continue to be in the public space, and we formed alliances and we formed coalitions. That is where the Border Women's Project, that is part of the Border Agricultural Worker Center, where I sit as a board of director, the president of the board of director. We formed this coalition and this group of women to focus on the women issue, because we knew that we were affected the most. We knew we were the caregivers. We knew that we still had to work and make ends meet however we could. We formed an emergency fund where the community donated, and every dollar went to single mothers. And on Mother's Day, it'll be 1 year that we started distributing that money to help with rental, whatever it was that they needed. And our food bank, we had to make one at, we've always had dispensas at the Centro, but we had to up our efforts, and the community donated to the food bank at the Centro to make sure that families were provided for that needed it. We had, much like the Reverend said, we had no access to the internet. Our farm workers still carry the Obama phones that were issued. There's no cameras, there's no Wi-Fi access. And if I'm having a hard time maneuvering with this computer and the technology, what was it for them? So that exists. So we had no access to register. We had no way to maneuver all this bureaucracy. And intentional obstacles, they are intentional. It just didn't happen that way. What happened with the pandemic is that it just lifted that veil of this delusion and illusion of freedom that supposedly we had. We know, as an Indigenous woman, as a migrant worker, as a farm worker, we know that never existed. It just exacerbated the conditions further. We had to learn how to take care of ourselves, and we continue to apply pressure to the local, city, state government, and to get these things resolved. Like I said, there is no way that our farm workers could get to these drive-through places, even to access food, testing, or vaccines. We were not on the list to get that. We've had to fight every single day to be that thorn on their side, to continue to bring and raise this issue and make sure that the farm workers are included, our migrants are included, our elderly are included, the community in the barrios are included. In 500 years, we have learned to maneuver the white man's way, and it was intentional. And we are going to continue to fight it. We're going to continue to fight it. Like I said, we were born, and I always say that we were born into this battle, and I will die in this battle, but while we're in this battle, we're going to clean some of the path for our youth to continue, because in spite of our obstacles and our violations and our abuse, I've managed to get kids through college. And many of the women, farm worker women, have managed to get their children through college and engineering schools. So we're here, and we are going to make a difference. And I just wanted to share that. And I hope that answered your question.
Thank you, Rosemary. That was a really good and insightful answer. In essence of time, I want to remind the panelists that you don't have to answer every single question, especially if you feel like you've answered that question in the previous statement, because a lot of these issues are linked. So if you feel like you've answered the question, you don't have to, answer it again when it comes in the form of another question to ask. But this is just to inform the public and to increase awareness. So with that, I'll be moving on to the next question. When talking about the success of something like this vaccine on a large scale, too often our homeless and marginalized communities are left out of the conversation. A majority of the people who work in the service industry do come from these communities and have been working throughout the pandemic. So why haven't the people who have come in contact with the general public at most been prioritized to be vaccinated?
Okay, well, I'll start. I mean, every state has had their own ways of approaching this. Yes, I do think that essential workers need to be high up in the priority list. The very first people that were picked were healthcare workers and the nursing home residents and their staff. And it's hard, given the limited vaccine, to argue that that wasn't a rational choice. And then after that were essential workers, although there are degrees of essential workers. And many of the grocery clerks, for example, and people who pick our food and so on, we're in the 1C category, not the 1B category. So it is a difficult question as to how one ends up prioritizing that. The good thing, I suppose, is that the Biden administration has made statements that by April 19th, everybody who wants the vaccine over age 16 should be able to get one. And already 31 states, as I understand it, use age 16 as their criteria. So essentially that means everyone, including all essential workers, are able to get the vaccine if they know how to negotiate the crazy healthcare system that we have. Other people may have comments.
I can answer, well, I can try to answer that. It was intentionally set that way. Essential are our janitors, our cleaning staff, because many of the women couldn't go to the fields, but they still had to work. So many of them are home healthcare workers that take care of the elderly and still without protection. They can't stay out of work. So it was designed that way because this is an invisible workforce. You don't see them, you don't hear them, you don't. So they thought prior to this, because what this did, the pandemic did, was it elevated everybody's voices. We collectively, if there's an injury to one, there's an injury to all here on our border community. And we still have that fraction of the militarization and the white supremacy groups that have come from all over the country to line the border area. They're not welcome, and they know they're not welcome, and they know that we do not stay quiet, and we have armed ourselves with cameras. We have the knowledge that we need to protect us as well, although we haven't always been very successful yet, as far as the attack that happened last year at the Walmart, where somebody drove across the state of Texas to kill 23, they wanted to shoot Mexicans. And we had such a such an outpouring of hate that came to our region. So we were bombarded with even more. You know, it seems like we're running from fire to fire, but that is the intention of this capitalist patriarchal system, to keep us with all these smoke screens that we can't organize. But in spite of that, we are still organizing. And the essential workers have been the invisible workforce, and they are no longer invisible, and they are no longer voiceless. So these webinars and these discussions that we have, it is so important to have these, because there are so many people that are still unaware. If they don't see it, they don't hear it, then it doesn't affect it, and that doesn't affect them. But there's no way that we are going to stay quiet. And I think when we do this all collectively, that we will have a huge impact.
If that's all we have, we can move on to the next question. There seems to be a lot of division among the working class, but being one medical emergency away from bankruptcy is the leading cause of bankruptcy in the working class. What other large factors unite the working class, and why is it important to shed light on these factors?
Yeah, I can start off with this, and then other folks can chime in. I think this is a really important question because, you know, we're up against a state and a ruling class that has been using divide and conquer tactics for hundreds of years. It's been exploiting and oppressing people in different ways, but all with the overall vantage point of controlling the entire working class. So it doesn't mean that everyone in the working class is exploited and oppressed equally, because if they did that, then they would build our unity for us. And they learned like pretty quickly on that they needed to figure out ways to separate us so that they could maintain their power. And so I think that part of what healthcare as an issue does is there's a way in which we're all connected to it. We don't all experience it the same way, but we do all connect to it. And that's why, you know, the work of the Nonviolent Medicaid Army, Put People First PA, the Poor People's Campaign, and everyone here is trying to engage in this model of fusion organizing that we talk about in the campaign. And it's also why we are statewide, because we can then see that, you know, from wherever we sit, we need to really understand the reality across geography of who is impacted directly, right? And that is always, you know, a function of maybe where we're sitting. But then when we look out and we learn, we understand that it's impacting communities, and our strength comes from uniting the farm worker community with the Black community, with the poor white community, with the Asian community, the Latinx community, and all of these communities. That's where our strength lies. And I think that what we can see in the vaccine is that, and COVID, is that of the over 500,000 people that have died in this country, yes, it's disproportionately affected Black and brown people, but 300,000 of those 500,000 people that have died have been white people. And I think that when we, when we fall into the narrative of divide and conquer, and we allow ourselves to be pitted against each other, then what happens is that that's a victory for the same state that is oppressing and exploiting farm workers, oppressing and exploiting all essential workers, oppressing and exploiting unemployed workers and caregivers. The same state that is doing that, you know, across urban, across rural communities and small towns, then has us all also fighting against each other and not recognizing like who has been impacted, right? So we must look at the disproportionality. That is true. We have to look at the disproportionality. And we also have to look at the raw numbers. Because when we look at the raw numbers, we understand who all is organizable. And then we also have to look at the disproportionality and make sure that we are centering the folks who are disproportionately impacted while we organize everyone who's impacted. I think those are really important ways that working on healthcare allows us to make those connections and to build that movement so that there's no one community that can be isolated and then targeted. Our targeting comes through our isolation. The more isolated we are as any group of oppressed and exploited people, the more easily we're able to be targeted, right? And so a lot of what we have to do is to come out and break that isolation. And healthcare is an issue that allows us to do that, to break our isolation and to connect with other communities and to see, like, to look out and to see who all is really impacted in this crisis and who do we need to be organizing in this crisis. And I think we need to look always at both the disproportionality and also at the raw numbers. We need to do that when we look at the 140 million, and we need to do that when we look at people who have been killed by this, by the handling of this crisis in a way that puts profit over people.
I 100% agree with Nijmi, because when you look at medical debt, for instance, people who don't have health care wait before they see a doctor or show up in an emergency room when their conditions are so much worse. And then if they get treatment and survive and they get this huge bill, then it just exacerbates the rest of their financial issues. And so when we begin to look at people who lack proper health care, and then we see how that connects to people who may not have transportation, and how that connects to people who may not have a living wage, it is about getting us out of our silos and connecting all of those people together. Like Nijmi said, that we say in the campaign, is about fusion, and to bring us all together and to lift all of our voices up and to have us all be seen and heard. That's where the power is. And that's where our work is as community organizers, as advocates, as activists, is to do that, is to force ourselves to get out of the silos and to bring us all along, because all of our struggles is the same. We're all struggling that people, everyone can be treated with dignity and respect, regardless of your particular passionate issue. If it's about the vaccine, if it's about living wage, if it's about lack of transportation, if it's about environmental protection, if it's about treating the immigrant with respect, it all works together. And so we all need to work together. And healthcare is what we're talking about today, but it does tie in to all of these other issues. And I think our work, again, as community organizers, is to bring us all along together so that in our numbers, as Dr. King said, we could become a new unsettling force.
Well, I'd like to raise another issue, another maybe angle to this. Capitalism depends upon cheap labor. That's how it survives. The original sin, of course, was to bring slaves to this country as a way of, getting cheap labor. And, with the abolishment of slavery, supposedly, we no longer want to talk about it, but we actually have a new form of slavery in this country. And that is in two forms. One are the undocumented, because they have no rights and we can exploit them in any way we want. And the other is indebtedness. And healthcare actually is a perfect paradigm for perpetuating this new slavery, because one, we deny anybody who is undocumented any healthcare benefits. And it's one of the ways in which we can lord over them and try to, control them. And the other is that healthcare is so expensive that there are literally millions of people who are bankrupted by by the mere sin of getting sick in this country. No other country bankrupts the citizens just simply because they get sick. But we do this routinely in America. And what does that do? It means that by making you indebted to the healthcare system, they get to control you. They get to, have ways in which they can make you do things against your will. And that is the new slavery in America, is indebtedness. And the healthcare system, because it's so expensive, actually does this in huge amounts. I could go on, but the point here is that most people don't think about it that way. And it's another example why the current system perpetuates institutional racism. I'll stop.
Thank you. We have a couple questions in Q&A, but here's the last question in general for the panel. Here in the U.S., we lack a robust social safety net that would keep individuals from falling through the cracks. While there is a debate as to how much the state should supply, it's painfully clear that what we have here isn't nearly enough. Can we discuss what a reasonable healthcare standard is and what effects it would have on our fellow citizens?
I have a really quick answer to that, and that would be accessible healthcare to our communities. Accessible healthcare as far as them not having to, if they don't have the money. We have a county health hospital here, and it's operating right now on profits. I know, I've been there. And if you don't have, they'll try to squeeze every penny they can out of you before they even see you. And you either have to be in very bad condition to be accepted or you're turned away. That is the reality. I have an autoimmune disease. I had to wait a year before I could see somebody because there was no way that I could afford healthcare. I had to wait until I turned 63. And so, how do I see that? It would be affordable care to all, accessible care without exclusion, without the bureaucracy of if somebody has documentation or not. Their documentation is their human life. They are human beings that should be treated with dignity regardless. None of us crossed the border because we thought it was going to be such an easy life. No, we've paid for everything that we've ever received, that we ever worked for. And, right now, we don't forget that the border we're connected to is Mexico. So let's care about, all that come here. They are working, they're escaping conditions in their country implemented by our government. To feed them into a private prison system now. We have teenagers, young children at a military base, being housed at a military base 10 minutes from where I live, walking distance from where I live. In a military base that right now is under scrutiny for deaths of soldiers here in Texas. And now we have children from Central America that are being housed there. There is no accountability. There is no oversight. So accessibility without any restrictions.
Yeah, I would really agree with that. Thank you so much, Rosemary. And I'm really sorry to hear about what you just said about your own healthcare situation. It's just wrong. And I wanted to say, another way of talking about that is universality, right? This is one of our principles. We have these 5 principles that we work with: equity, universality, transparency, accountability, and participation, that should characterize, the healthcare system to meet our human rights. And I think, we've got Walter here who works on Medicare for all. We've got the Nonviolent Medicaid Army working on Medicaid for all, right? Whether we build it from Medicare, from Medicaid, we need a system that is completely free at the point of service and completely accessible, as you said, Rosemary, to everybody in, nobody out, totally universal. it's absolutely possible to do. We learn so much from nations like Cuba and other places where, again, their healthcare, they send doctors around the world, right? They're not only providing care to their own people, they're providing care to other people. They care about the entire international global working class. They've sent healthcare workers all around the world. So it's totally possible. And I think the other thing that I just wanted to say when we're talking about what the baseline is, as you asked, Terrell, one of the things that makes healthcare organizing so powerful as a fusion issue here in Pennsylvania, right? What we have is we learn, like, when we have our undocumented family joining our organization, they realize that just because someone else is a citizen, that doesn't mean they're getting health care, right? That's a big light bulb goes off. They're like, whoa, really? I thought if you were a citizen, then you had access to everything and you got your needs met. Not true, right? Or if you get a job, right, you'll have health care. Not true, right? Like lots of people have jobs, but they don't have health care and they don't have benefits. So there's always this kind of situation where everyone thinks, well, the other person is getting something I'm not getting, or I'm getting something, right? And when we actually come together and we understand what the true conditions are, is when we realize, wow, this is something that cuts across different communities. It's something that brings us together. We do have different experiences, but we actually learn, sort of the scales fall off of our eyes and we understand, okay, this is a systemic rooted problem, right? This is a systemic issue that goes to the foundation of how our economy is structured, not only in the US, but globally. And so healthcare becomes, a real revolutionary issue, because we can see, as you had said earlier, Walter, that neither of the parties actually has a solution to this crisis for us. You can see what's in the American Rescue Plan is simply an extension of subsidies to insurance companies, right? To private healthcare corporations and to insurance corporations, and not actually shifting healthcare to be a human right and a public good. And that is really what we need. That needs to be the baseline that we're working within, that we understand, and building from the bottom up, the working class understanding of what needs to shift, and fighting for it as a human right, and fighting for it as a revolutionary demand in this country.
Well, I'll just simply say that, Americans want quality, affordable health care, and they want it for all Americans. If you ask them in surveys, they repeatedly say something like that. The real problem, and the measure upon which any healthcare reform system look at is, to the extent, does it provide quality, affordable healthcare, and is it for everybody? So Obamacare, we like perhaps President Obama, but it fails in that respect. Is it for everybody? No. Is it actually affordable? No. Is it quality care? Well, it depends. I mean, arguably, we have some good quality care, but for the money that we spend on healthcare in this country compared to the rest of the world, our life expectancy is like 2 to 3 years worse than that of all the other major countries. So from that perspective, we failed on that too. So Americans are paying gobs of money for a healthcare system that is arguably very bad value for our money. And if you're a conservative, a fiscal conservative, you should be outraged that we spend this kind of money for a system that is that bad. The only way you can get around it is to adopt what other countries have figured out a long time ago, which is to have a national health insurance, single payer, Medicare for all system. That system actually does provide all the things that we really want. And it's our job to really move us away from this market-based approach to making healthcare a public good. Thank you.
Okay. Well, we want to thank all of our speakers for their insight, wisdom, leadership, above all, their experience and shared struggle that connects the masses. It's that struggle that connects us all. But sadly, insurance and pharmaceutical industries that uphold capital above public health will never be the solution. It's no coincidence that both industries have recorded record high profits in the past year as the general public suffers an inhumane physical and mental strain that could have been heavily mitigated by a national healthcare system. This space is important because we are all centered around one another and have no financial incentive or stake in supporting, quite frankly, a healthcare system that operates like a mafia, where at best, we choose what parts of our body we want to care for, inadequately, by the way, as opposed to just being taken care of in totality. At worst, not being covered at all. We covered a range of issues, all centered around public health, and all these issues are connected. So again, I'd like to thank all the panelists and everyone who listened in. Now, and me to close this out.
Thank you so much, Terrell. Thank you so much for moderating. It was fantastic, and your questions were extremely generative. I want to thank our speakers, Nijmi, Walter, Reverend Foster, and Rosemary. Thank you so much for being here, especially on a Wednesday night. I'm sure we're all very busy. And I want to thank our interpreters, Aldo and Anais. Thank you so much for doing Spanish interpretation throughout this whole event. And we want to thank everybody who came to participate in this convening and everyone who posed questions. I know there was a question about organizing initiatives, and we just want to put into this space that we held this event as part of the International Week of Anti-Imperialist Struggle under the slogan, "In Defense for Life Over Profit, Vaccine and Public Free Healthcare for All Now." The International Week of Anti-Imperialist Struggle will be holding an international seminar for life on their YouTube page at 10 a.m. tomorrow, BRT, which is 9 a.m. for our East Coast audience, and a little early, 8 a.m. for our Central Time audience. The YouTube stream will have Spanish translation, and Arabic translation will be streamed on their Facebook page. We encourage everybody to attend those events and check out the International Week of Anti-Imperialist Struggles website for other materials and resources. Rosemary mentioned that there is a Manifesto for Life, and that's also on their website as well. Thank you, everybody, for coming, and have a nice evening.
Thank you. Abrazos. Mucho amor.
Thank you so much, everyone. Great to be here with you.
La lucha sigue.